Welcome to Love and the Bug.
I'm Rianne.
And I'm Sammy.
And we've been friends for over 20 years.
When COVID-19 pandemic began, we decided to get our heads together and find out from friends how they were really coping in this awful pandemic.
We were especially interested in how it was affecting their relationships. So we thought we'd get a few of them together and interview them. They're all of similar age, but all with very different stories and experiences.
We hope you enjoy it.
Josh is a 25-year-old nurse who's been working on the front line in some of London's hospitals during the pandemic. We talk about the initial anxieties of his family and his partner Scott, and how his beloved dogs have seen him through. Enjoy.
So I am Josh Sharman. I live in London and I'm a registered nurse.
Ooh.
Amazing. Thank you, Josh.
Let's all clap for Josh.
So where are you working at the moment, Josh?
I left full-time clinical nursing a couple of years ago and have been teaching at a university within London. So I mainly teach clinical skills, which I still been doing full-time. But obviously, over the last couple of months, I've been doing a lot more clinical stuff at St Thomas's Hospital.
Oh, wow.
Other hospitals in London as well. So I've been doing some agency stuff. So just been going out to Kingston on a couple of occasions, working at the Royal London. So a number of different hospitals, so seeing different things.
What's your experience been regarding COVID in hospitals?
So initially it was a bit of a worry, even for myself really. I've never really been scared of working, but when this all first came out, I remember my first shift, I was really quite anxious about what it was going to be like. I think it's been very different. I've not been working full-time clinically, so while I've been working most weekends, I've kind of been able to have a break, so it's definitely been more bearable for me than it has been for a lot of my colleagues. But it has seemed to have developed day on day, so each day I've gone back, it's been very different compared to the previous ones. And I've worked in different areas as well, so again, it's just been different experiences. Initially, it was pretty hideous at the peak, but since then, things have got a lot better. I mean, the last shifts that I've just done over last night and the night before were by far the best out of this whole of this crisis. So hopefully things are moving in the right direction. Things are a lot more stressful. Staff are being able to recuperate a little bit. So yeah.
Josh, that's amazing. Frontline in St Thomas's in London, like holy wowzers. So like, what's the word on the street? So when you first went in and you're chatting with your colleagues and everyone's a bit like, oh, what's this COVID stuff? You know, were you all just going, oh Christ, we've never done this kind of, like, what were you all thinking? What was the initial impression?
So initially it was really weird. Like I said, I'd never really been scared of going to work before, and I don't know if I was scared or whether it was just anxiety about the unknown. Looking back on it now, everybody at the start of this pandemic nobody really knew what to expect from it at all, and I think everybody was very anxious. If I was to get sick, would I be able to be cared for? Would there be somewhere for me to go if I am sick? I think that was all the anxiety at the start.
So what's your relationship status? Where are you living, and was there risk of like your partner getting COVID?
I'm with a partner, living with him and two dogs throughout all of this. So I have been very, very worried about it. I mean, again, I felt like it's been okay. I mean, everywhere that I've worked, I've been working in the HDUs and ITUs quite a bit. So I've always been offered scrubs. So I've been able to like take clothes there, change out of them, and then do the opposite on the way back. So I know that other colleagues have had to like take their uniform home and be washing the stuff at home, which was a lot less anxious for me to do. But just making sure when I got back that I cleaned everything that I touched. I got in the shower before I did anything. But yeah, I have been worried about it. Again, that was one of the initial worries that has got better over time. But yeah, I was very anxious about passing it around, even not just between me and my partner, but also then I think I was then very anxious about going outside as well and then passing it on to other people. And again, that's got a little bit better over time, and I've been able to manage that a little bit more. But I was definitely questioning my morals at the start of this, going, oh my God, should I be going out? Is it fair for me to go? Like I said, I've got 2 dogs. So I was even questioning whether it's safe for me to go out walking the dogs. Is that fair that I go and do that? So yeah, it was just all the uncertainty, which I think has affected a lot of people and will continue to affect people. I'm hoping now, because we know a little bit more as to where we stand, what it actually is, how we do manage it, that things are going to get a little bit better with it, even if there is this second wave, supposedly. The only thing that I worry about with the second wave is that staff morale in this hospital has definitely been, in all hospitals, has been damaged. And I don't know if we've got the courage to continue to go through another wave that could potentially be worse than this one. But at least there is the less uncertainty around it, and we kind of can just put on our PPE and get on with it.
Yeah, you kind of know what to expect now, and you can be prepared for it, unlike last time where it was just came out of nowhere.
Yeah. Josh, as a nurse, when you go outside and you see people blatantly flouting the rules, which is what you see quite often, especially in big cities, do you just want to punch them? Like, how do you feel? Do you just want to say, I have just gotten off a 12-hour shift and seen some absolutely horrendous things. What are you doing?
So I've been pretty, I have to admit, I've been pretty laid back by it. I'm usually quite laid back by most things anyway. And I've kind of just always taken the stance that people can make their own decisions. I'm not going to question people as to what they want to do. We know what's going on throughout all of this, and if people have been going out and abusing those rules, then I think that's their own morals that they've got to question, really. So I really haven't been that bothered about it. I know my partner Scott, on the other hand, has been a police officer and questioning everybody who's been going.
What are you doing out? Why haven't you got your exercise gear on? How long have you been here?
Becomes really officious. We have as well. We're awful. We are awful people when we go outside.
So that's the only time that I've been stressed about it, because my partner Scott's been policing the whole of our street, saying, "Oh, I'm gonna sort this out. I'm gonna do something about this," and I've just been like, "Just leave it. Just leave people to it." Like I said, people are adults.
Sure, the guys at number 9 have been out 3 times already today.
That was exactly Scott. That was Scott. So that's the only time that I've been stressed, really. But I know that people have been not happy about it, and I completely understand. I've just been trying to be a little bit more relaxed about this situation. There's no point in me kind of trying to control things that I can't. And like I said, if people want to go out and abuse it, then that's their own morals that they've got to question, really, and they need to have words with themselves, and that's what I've kind of left it to.
Yeah,
sensible. I think there's a lot of it just needs common sense, and people need to make their own decisions and decide if they're willing to risk their own health, or if there's a potential that they might be going to have to see somebody who's more vulnerable and could pass it on. Then people have to make their own decisions to a certain extent. I think it hasn't helped that the advice has been so contradictory all the way through and so vague. So people are going to interpret these things in very different ways. So I think it's tricky.
You never know people's circumstances as well. I've always been quite acutely aware, living in London, I don't know what situations people are living in. And actually, for myself, if I was living in a flat share in a small 1-bedroom house where I'd usually been out going to work all the time, I actually don't know myself whether I would have been one of those people that may have been out 2 or 3 times in the day just because I needed that escape. And again, you just don't know what people's situations are. Mental health, obviously, throughout this is something that we need to be acutely aware of and trying to manage. And although the rules strictly were only going out for 1 hour a day, again, you just don't know people's circumstances and what actually stress they're under. We've all heard about the domestic violence situations that have been going on as well.
Yeah.
So yeah, I've kind of just been sat back from it and just allowed people to make their own decisions. So,
Josh, how has your mental health been, and Scott's? So this is probably two questions, but how have you coped with it?
So I actually feel like I've coped quite well. There hasn't been a stage throughout this where I felt like I've been losing control in any way, or I felt like my mental health has been affected by it. I think, and this is something that I've said to my friends when we've been talking about this, I think this is something that we may see affecting people for a good few years, and we don't necessarily see the effects until all this is over and we've been able to sit down and properly reflect on what has happened. So I don't want to say that I haven't been affected, because I may have been, but throughout all of this, both me and Scott have been able to work together and manage our way through this situation. He's been quite often working in the lounge, for example. I've been working in the bedroom, doing things. So we've kind of found a routine, which I think was really important. I would go out running in the mornings, Scott would go out running in the evenings. And I think that routine to us has been quite important as well. And I have to admit, unfortunately, I know a lot of people don't have dogs, but the dogs have literally been a lifesaver, being able to spend time with the dogs, who usually I don't see Monday to Friday, 9 till 5. Having that time that I've been able to spend with them, has been amazing from my perspective. But I know that a lot of people don't have dogs and don't have that.
I think dogs up and down the country are going to find it really tough when we all go back to work and they're left for
this
hours
is my
on end.
worry, especially one of my dogs, Alfie, the younger boy, who is definitely a lot more clingy than the independent girl who would just go and do her own thing. Alf is like my little shadow following me around. I am definitely a lot of anxiety about what's going to happen when we go back.
Yeah. In my house we've got 2 dogs, and they're already getting major separation anxiety if we go out without them, or we're just not around for 10 minutes or something, and it's a bit worrying. I'm more worried about their mental health than ours.
They'll be ringing the NHS line.
Yeah.
Oh,
so have you noticed that with both of you being at home, with you and Scott being at home and stuff, obviously you've been out to hospitals a lot, but the increased time that you're spending at home together, has that put any kind of strain on your relationship, or has it made you closer? Or like you said, you've kind of worked out quite a good routine where you've worked around each other. But
so I think it's probably made us closer.
Oh, that's nice.
Again, I have been quite lucky being able to go to work and have that time where we've both been able to have a bit of a break. So I do think that has made a difference. Especially with me working on the weekends, it's meant that Scott's been able to stay here. We both tend to watch different things on TV. So the days that I've been at work, for example, he can just put on TV and do what he wants. So I do think that's been a real help. It may have been a different situation if we were completely with each other. So I was actually quite thankful that I could go out and work, because I think that was a really good break for me. But no, I think it has brought us together and made us a little bit stronger. So yeah.
But like when you get home, Josh, and I've done this so many times where I've had a tickle in the back of my throat, or I feel a bit hot. I'm like, oh my God, I've got it. Have you had moments of that, thinking, oh my God, what if I bring it home? What's going to happen?
Yeah, so there was, so I do probably think that I did have it. So I did have a cough that lasted for about a week at the start of all of this. So so I think the main lockdown weekend, the Monday, so I didn't work that weekend, and then that Monday, the first day of the lockdown, or was it Wednesday, first day anyway, I then had a cough that lasted for 7 days, so we were isolating for 14. So yeah, it was yeah, so I did think I did have it. But again, I was uncertain. I only had a cough. Scott has shown no symptoms at all. So I don't know if we had to have it. Was it just a cough? I was definitely at the time wondering what it was. But after that, I've just kind of tried not to think about it too much. I know that's easier said than done. But yeah, I've not felt really at any point that I've been overwhelmed with the anxiety around it. But I know, again, a lot of people have, and it's been really difficult, especially for people that already have existing health anxiety. It must have been pretty awful to have this extra load put on you and worry. So yeah, I do completely understand that. Again, I think because I've worked in infectious diseases before, I felt that as long as PPE has been available, which I do have to admit it has been for me, I felt pretty safe in my own situation. Like whenever I've been working, I've always cleaned the space that I've been in before I've been working in it. And that has been more at the forefront of my mind, and that's calmed a lot of the anxieties for me, knowing that I'm doing everything correctly. I'm not going to be at risk. But yeah, there was definitely, when I came in, I've got some anti-bac wipes. Everything is anti-backed. The shower, my routine when this all first started, I was even washing the shower after I'd been in it, like picking everything up, putting it on a 90-degree wash because I was worried that it was going to stick in the washing machine, and yeah, all of these things. But again, it has got a little bit better, and definitely, while I am very still conscious of it, and the 90-degree washes aren't happening anymore. Everything's all going on to a 40. I'm not washing the shower down, especially when I come back off at night, because that took me about half an hour while I was still half asleep to try and wash the shower down with bleach and everything. So yeah, I think things have got a little bit better. So yeah.
Was there ever a time where Scott almost didn't want you to go to work, or were there questions around whether it was safe for you to go? Was he ever kind of questioning that and sort of saying, I'm not sure you should go? So
initially there was a little bit of, and I think the same was for me as well. There were questions as to whether it is safe for me to be doing it. And Scott did say to me on a couple of times, because I only work bank, he was like, oh, you don't have to do it. I was like, I feel like I have to do it, and I want to do it. Again, he's quite laid back as well, and it's never got to the point. And if he didn't want me to work, then I would completely respect that. And going forward, one of my anxieties is, so Scott's mum's in her 80s. One of my worries is that if I do continue to work through this, I've got to be very aware that if Scott wants to spend time with his mum, I don't want to put myself in any situation, whether it be me working, whether it be going out with friends, for example, anything like that. I wouldn't want to put myself in a situation whereby I could potentially make his mum ill at a time when it is suitable for him to be seeing her. So that's the only real worry that I've got going forward, that I may just have to take some time off just so that Scott can spend some time with his mum and not expose us. But I then am also aware that that is something that I'm very lucky to be able to do, and a lot of people can't. So yeah, just the way about going it. So
yeah, your family must be so worried about you.
So my mum throughout all of this has definitely been the main worrier in my life, as mums always do. So I was going to work last night, and like I was saying, I was working on a HDU, which all of the HDUs pretty much are COVID related anyway. A few of them aren't now, but she was like, oh, where are you working tonight? And I was like, oh yeah, working at St Thomas's on the HDU. She was like, is it COVID? I was like, yes, mum, like it was last night. So I just don't understand. Why do they have to keep putting you there? Why do they keep putting you there?
Oh, bless her.
Oh, it must be awful.
Yeah, and I'm always reassuring, and I completely understand those worries. But yeah, my mum's been worried about all of this, especially initially as well. Again, when the uncertainty was around as to what this actually was. So I was trying not to tell my mum, but she's on Find My Friends. So I share locations with her. So while I didn't tell her, I know full well, because she set it up so that she gets notifications for every time I leave the house as well. So I just get a phone call at like 2 o'clock when I was working at the Royal London. She was like, "You didn't tell me that you were in a hospital today." I was like, "Well, I didn't want to make you worry about it." I was like, "Everything's fine, don't worry. Have you got PPE?" "Yes, Mum, I've got PPE. Please don't worry. Please don't worry."
I love her. That'd be the mum I'd be. Be like, "What are you doing? What are you doing?"
What a legend.
Yeah, my dad's then very much like me, so very laid back, not really ask many questions about it. Just, "You're right, son." "Yeah,
Good day,
I'm
son.
good."
Yeah.
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 Polar opposites with my parents completely.
Oh, it's lovely.
Tell us about your relationship with Scott. How long have you been together? How did you meet?
So we met through a friend, and we got together in 2016. So I think 4 years in March we were together. So yeah, we've been together for quite a while. We're now living together with our 2 little babies, the dogs. So yeah, met through a friend, and then haven't really been apart since we first met, actually. So I just qualified at the point when we were just getting together, and I went and lived in St Thomas's Hospital for about 9 months before then I actually moved in. So yeah.
You don't muck about?
No, not at all.
Oh.
Well, when you know, you know.
Yeah, exactly.
Exactly. Oh, it's lovely. And Josh, just like a story from the ward, there must be, because we hear so many awful things, like give us a story of a positive, I don't know, patient, someone that you didn't think would make it, or you must have a few of those up your sleeve.
So I have got one story, which was probably been one of the hardest things and also the highlight of my career. And I have to be careful with what I say here, because I think even I'll well up as well, and I want to protect the confidentiality of the patient. But so I was working in an intensive care unit in Kingston, and this was pretty much at the height of the pandemic. And I was looking after a young lady in her 20s who was a brittle asthmatic. So basically has got quite a severe form of asthma and had a COVID-related exacerbation of asthma and had been intubated. She'd been in intensive care multiple times with her asthma anyway. But she'd got better, and the shift that I was working, she was decannulated. So quite often in intensive care, when people have been intubated, for a weaning process, trying to get them off a ventilator, put a hole into their neck, and it's called a tracheostomy. And when you decannulate someone, you essentially take that tracheostomy out and you allow them to use their upper airway so that they can breathe for themselves. She was also registered blind and had an awful lot of anxiety as well. She had quite a lot of existing comorbidities going on. So thankfully she got to the point where she could be decannulated, and one of the hardest things was her dad was in Spain at the time and couldn't get back, and you still couldn't have visitors coming in to see them anyway. But her mum had actually written her a letter for the day that she was decannulated, and I had to read it out to her. She was in tears, I was in tears, which I'm usually like pretty much got a heart made of stone. I don't really usually get upset by anything like this, but I had to read this quite long letter out to her, and she'd given her a present that was a little toy that was pretty much just sensory. It's a knitted little toy that had got little things over it so she could feel it. But I had to read the letter from her mum out to her that was all talking about hope, wanting her to carry on, make sure that she's still fighting. So that was really, really difficult. But then I went back and I actually found out that she was then stepped down onto the ward and had been discharged within a couple of days following the tube coming out of her neck. So that was a really, really special moment, and has probably been the only time in my career that I can think of where I've actually, I've worked in palliative care before, done all of that. I can speak to family members in difficult situations, but that was really, really difficult, actually trying to get the courage to be able to read that out to her in a way that did her mum justice in the way that she was writing it was a really, really special moment for me. And obviously her being a young girl, she was the same age as me. I think that just added some extra pressure as well.
Yeah. Oh, I want to cry now as well.
I wouldn't be able to cope with stuff like that. I'd be in absolute pieces.
Yeah.
Josh, knowing, like, you've obviously seen life and death more than most people. What would you share with people that you've learnt from this whole thing? Like, if you were Prime Minister for the day, or if you could share a really piece of useful information or something that has really hit you during this crisis, what would it be, if you can think of anything?
So I think the thing that I have learned and I will take away from this is good health. I think as a society we need to start looking after ourselves a lot better. Unfortunately, people's existing conditions like diabetes, obesity, have caused a lot of people to not survive this. And I think going forward, public health needs to be on the very forefront of what we do when we're trying to think about things like health promotion, for example. Looking after yourself is really, really important. And there's a reason that we need to be looking after ourselves more in these types of situations. So I've been very, very mindful of that as a society. I don't think that we've been helping people enough to make those right decisions and inform them enough as to the decisions that they should be making. It's kind of been very much, if someone gets diabetes, we will treat it, rather than thinking about how we can prevent it in the first place. So I'm really hoping that that's something that we continue to take forward. I think even as healthcare professionals, we need to be offer a lot more advice around decisions that people are making, and also not to be and be more direct with it as well. I think in the past we've been very much, these are the decisions that you can be making, and I just don't think we've made people aware as the type of the effect that things can have on the body if they're not looking after themselves in a way. So I hope that going forward that's something that we continue to do. And I think for myself, that's definitely something that I'm going to try and make more people aware of, that looking after yourself is really important.
Fantastic.
Yeah, I think diet, it is just about education. So many people don't actually know how to cook or where fresh food comes from. They're just so used to processed man-made food, and they have absolutely no idea that how much damage it's doing to them. And it isn't necessarily that they don't want to. It's just they literally don't know. So like you say, it's just about educating people and making it easy for them as well to just live. It's amazing how many people now are exercising during lockdown that weren't before. I mean, that's been a major positive, hasn't it? Like, everyone's out doing yoga and running.
I really hope that continues. I really do. I don't want to in any way, shape or form go back to the life that we were living before. So I do hope that continues to change, and it's going to be something that I'm definitely going to try and change going forward.
Wonderful.
You're so inspiring. You're brilliant.
You are, and you can't. It's criminal that you look that good on 3 hours sleep.
I know.
Because you're still young, Joshy. You wait.
Ridiculous.
You wait till you get to my age, love. You are scrumptious, Josh. I cannot wait to squeeze you and Scott so badly.
Well, thank you ever so much talking to us, Josh. It's been an absolute pleasure. I think you're a legend, and thank you for everything you've been doing so far and everything it sounds like you're going to continue doing. It's
thank you.
very inspirational.
I do want to say thank you to everyone really that's been clapping every Thursday night. I think that has made it a real difference to the morale of staff, and that has been pretty changing to see that it's kept everybody going. I think the general public has really kept all of the staff going and continuing to fight this. So I think everybody's played a real big part in this. So yeah, thank you for that.
Wonderful. Thank you, Josh. Take care of yourself.
Thank you.
And
Thank
so
you.
much.
Thank you. Bye bye.
Bye, sweetheart.
Thanks so much for listening to our podcast.
Check out the next episode for another one of our amazing mate stories.
See you next time.